Hello friends, let's see the anatomy of the axillary artery. The axillary artery is the main arterial supply to the upper limb, and it is the continuation of the subclavian artery. When the subclavian artery crosses the outer border of this first rib, it is called as the axillary artery. So here the artery which is continuous beyond the outer border of the first rib is the axillary artery. So this hole is the axillary artery. The axillary artery when crosses this teres major muscle, it is now called as brachial artery. So here in this figure, this one is the brachial artery. So the course of the axillary artery, it extends from the outer border of the first rib to the lower border of the teres major muscle. This large muscle which is situated in the course of the axillary artery is the pectoralis minor muscle. This pectoralis minor muscle is the key muscle which is dividing the axillary artery into three parts. The part of the axillary artery above it, it is the first part of the axillary artery. The part which is situated behind the pectoralis minor, it is the second part of the axillary artery. And the part of the axillary artery below the pectoralis minor muscle is the third part of the axillary artery. This axillary artery lies within the axillary sheath, which is actually the continuation of the prevertebral fascia of the head and neck. Now let's see the branches of the axillary artery. The axillary artery having six major branches and one occasional branch. The first part of the axillary artery which lies just above the pectoralis minor muscle, it gives one branch that is called as the superior thoracic artery, and the superior thoracic artery it runs along the upper border of the pectoralis minor muscle. The second part of the axillary artery gives two branches, and one of them it passes upward and going to pierce the clavipectoral fascia, and this branch is the acromiothoracic artery. This acromiothoracic artery gives rise to the four branches after piercing the clavipectoral fascia, one which reach up to the deltoid muscle, and that is called as a deltoid branch. One reach up to the acromial process, that is called as a acromial branch. One reach up to the clavicle, and that is the clavicular branch. And one is going to supply the pectoral region, that is the pectoral branch. The second branch of the second part of the axillary artery is the lateral thoracic artery, which runs below the lower border of the pectoralis minor muscle. And that lateral thoracic artery, it gives one large branch to the breast in case of the female. The second part of the axillary artery, sometimes it gives one occasional branch, that is the LR thoracic artery. This LR thoracic artery is going to supply the axillary lymph nodes and the axillary fat. The third part of the axillary artery gives rise to the three branches, and one of them is the subscapular artery. This subscapular artery it runs along the lateral border of the scapula, and it is the largest branch among the all. This subscapular artery gives one branch, and that is going to wrap around the scapula, and this branch it is called as the circumflex scapular branch. This circumflex scapular artery it passes through the upper triangular space which is situated around the scapula, formed by the teres minor, teres major, and the long head of the triceps muscle, which we have already discussed in our previous video. Now the second and the third branch from the third part of the axillary artery, they are the circumflex humeral branches. The anterior circumflex humeral artery, it is going to pass in front of the surgical neck of the humerus and going to wrap around it. This anterior circumflex humeral artery, it gives one ascending branch and which runs within the intertubercular sulcus or within the bicipital groove along with the long head of the biceps tendon. The last branch of this axillary artery is the posterior circumflex humeral artery, which is going to wrap around the surgical neck of the humerus from the posterior side and going to anastomose with the anterior circumflex humeral artery. This posterior circumflex humeral artery, it runs along with the axillary nerve into the quadrangular space around the scapula. For the revision purpose, the first part of the axillary artery gives only one branch, the second part gives two branches, and the third part gives three branches. From the first part, the superior thoracic artery is going to get origin. The second part gives two major branches. One is the lateral thoracic artery and one is the acromiothoracic artery. One occasional LR thoracic artery is provided from the second part of the axillary artery. The third part of the axillary artery gives the subscapular artery, which is the largest branch among all the branches of the axillary artery, and which gives one circumflex scapular artery, which is going to wrap around the scapula. And the another two branches from the third part are the anterior circumflex humeral artery and the posterior circumflex humeral arteries, which are going to anastomose around the surgical neck of the humerus after wrapping from the anterior side and posterior side respectively. So this is all about the branches and the anatomy of the axillary artery.